Hi, my name is Lisa Campbell-Smith, and I'm doing my presentation on the effects of ephedrine on athletes. Performance is of utmost importance to the aspiring or already established athlete. Different sports require different expectations, physiques, and strengths for their athletes. Athletes will often take drugs in an attempt to enhance their natural qualities for the sport in which they are competing. Many young athletes will risk everything, including their health, in an attempt to outshine the competition and make it into the professional venues. Banned drugs. As you see on this slide, there are certain drugs that are prohibited from all competitive sports. Stimulant drugs such as amphetamines, cocaine, modafinil, and ephedrine. Narcotics such as morphine and pethidine. Beta-2 agonists, retoprolol, and isoprenaline. Masking drugs or diuretics such as amiloride, furosemide, chlorelidone, and etiquinic acid. Anabolic steroids such as testosterone, nandrolone, stanozolol, and methamphetamine. Glucose corticosteroids such as bechamesone and triamcinolone. Drugs that are prohibited in certain competitive sports would be beta blockers such as atenolol, bisoprolol, metoprolol, propranolol, labetalol, carvedilol, pindol, and sotalol. Drugs that are not prohibited at all in competition would be antihypertensive drugs such as calcium blockers, AR blockers, and ACE inhibitors, local anesthetic xylocaine, cholesterol-reducing drugs such as simvastatin, acipamox, fluvastatin, azacitidine, and chlorosomine and folabrate. History of use. Ephedrine is a stimulant which affects the central nervous system and has lipolytic and appetite-suppressing qualities. It is an alkaloid extract from ephedra shrubs growing in Asia, Europe, and America. The Asian species, particularly the Chinese species E. sinica, also known as moihang, has the highest alkaloid content. Its chemical structure is closely related to amphetamine, a drug that mimics the effects of adrenaline in the body. In the past, ephedrine has been used as a recreational drug, but studies have shown that at least half of student athletes use it to enhance performance. For the student athlete, ephedrine provides quick energy and assists with weight loss, which in turn improves speed and appearance. Football, track and field, and weightlifting are the sports in which ephedrine use is the highest. Effects of ephedrine. Some physical effects of ephedrine would be, like I said, stimulates the central nervous system and gives quick energy, increases heart rate and speeds up metabolism, causing the body to burn fat. For the athlete, this combination of energy and weight loss improves speed and appearance. Some adverse effects, starting with the mild physical reactions, would be headaches, dizziness, nausea and vomiting, insomnia and sweating. Serious reactions would be increased heart rate and blood pressure, stroke, seizures, heart attack, and death. Psychological effects would be confusion, hallucinations, psychosis, nervousness, agitation, or restless and severe depression. Dosing and doping. The World Anti-Doping Agency, or the WADA, was established in 1999 as an international dependent agency that works towards a world where all athletes compete in a doping-free sporting environment. The World Anti-Doping Code, or the Code, is the document that standardizes regulations regarding anti-doping in and throughout all the sports in all the countries of the world. It provides a structure for anti-doping policies, rules, and regulations for sports organizations and public authorities. Since the code was adopted in January 2004, it has proven to be a very powerful and effective tool in the organization of anti-doping efforts worldwide. Doping is defined as the presence of a prohibited substance or its metabolites or markers in an athlete's bodily specimen and the use or attempted use of a prohibited substance or prohibited method to increase athletic performance. If the concentration of ephedrine in the urine of an athlete exceeds 10 micrograms per milliliter, it is considered to be doping. In 2003, more than 50% of doping offenses with stimulants were because of ephedrine and its stereoisomer pseudoephedrine. Regulations on ephedrine use. The FDA, or the Food and Drug Administration, was once able to safeguard the public from unsafe supplements, but lost its control with the Dietary Supplement and Health Education Act of 1994. This Dietary Supplement and Health Education Act was signed into law on October 25, 1994 by President Bill Clinton. The Act states that the dietary supplement or dietary ingredient manufacturer is responsible for ensuring that the dietary supplement or ingredient is safe before it is marketed, and that manufacturers must make sure that product label information is truthful and not misleading. The FDA can only take action after adverse health reactions have occurred. In 2004, the FDA banned ephedrine from the market due to its involvement in adverse reaction cases. Since ephedrine is used to enhance performance, athletic organizations such as the International Olympic Committee, the National Collegiate Athletic Association, or NCAA, the Major League Baseball, National Basketball Association, or NBA, the National Football League, and the Fédération Internationale de Football Association, or the International Federation of Association Football, otherwise known as FIFA, have all banned systemic use of ephedrine products. Since 2004, the World Anti-Doping Agency has been coordinating the anti-doping fight and has lists containing prohibited substances and methods. Incidence. Starting in 1985, the NCAA has performed studies on the use and abuse habits of college athletes every 4 years. Based upon the results from these studies, the NCAA had added ephedrine to its banned substance list and began screening for it in drug testing in 1998. In 2001, the NCAA documented that more than 60% of its athletes were using ephedrine products before starting college. Ephedrine accounted for less than 1% of herbal product sales, but was implicated in 64% of adverse herbal reactions in the United States in 2001. Management. A pilot program known as the Adolescents Training and Learning to Avoid Steroids program involved more than 3,000 high school football players who were split into 2 groups. The intervention group participated in interactive classroom and exercise training sessions, which focused on nutrition, drug effects, and drug refusal role-playing that were led both by student athletes as well as by educators. The control group received brochures with similar information. At the end of the study, the intervention group was more knowledgeable of steroid and drug effects, were less likely to believe supplement ads, and were more able to reject drug offers from peers, which resulted in fewer steroid users. A similar pilot program, geared specifically for female athletes, resulted in a significant reduction in use of diet pills, amphetamines, anabolic steroids, supplements, and alcohol. Athletic organizations have implemented rigorous drug testing on athletes. Athletes in high school can be subjected to such tests based off the 1995 Supreme Court ruling in the case of Vernonia versus Acton that authorized schools to test for drugs because it does not violate the reasonable search and seizure clause of the Fourth Amendment. Meaning because they're on school time and they're funded by the state, the school has the subject to test them at any time. The NCAA tests all 3 divisions of championship events and performs random drug testing year-round at Division I and II in football and Division I track and field for both men and women. Division III is only subjected to NCAA testing at championship events. In conclusion, and some of my recommendations would be the WADA is constantly updating their list of prohibited drugs. As one drug gets tested and placed on the prohibited list, athletes find another substitution. The WADA also has to find tests that will detect the presence of new drugs that are found in the system of athletes, and then have to be able to identify these drugs. There needs to be more drug education programs available in the schools. These programs should be introduced from the middle school level and then more aggressively during the high school years. These are the informative years of children, which is when they're most absorbing, most likely to try this stuff to get better, most conscious about their body and physical appearance. This is when these programs need to be rigorously implemented. There should be funding also allocated for the random drug testing of high school athletes to discourage the use of drugs and performance-enhancing supplements. Habits are hard to break once they're starting so young, so you get used to it from the high school level. Collegiate level is hard to get rid of. It's even harder during the pro level. Ephedrine is dangerous, as well as many other drugs, and yes, I believe the ban should stay, and I hope it does not get overturned and get lifted, which is they're currently in court right now, the FDA and the state. Thank you for listening to my presentation. If you have any questions, feel free.